Welcome to another episode of Health Hustle Chronicles, where the grind meets growth in the world of healthcare. As you know, this ain't your typical podcast because I bring you some of the freshest, some of the livest guests from around the world. Craig. And today we have a very special guest who goes by the name of Dr. Uche Anyanwagu. He's an MD and he's a clinical epidemiologist and public health physician with expertise in research and patient care. He holds a medical degree from Abia State University and a master's and a PhD degrees in both clinical epidemiology from the University of Nottingham. He has published over 40 research works in international medical journals and presented over 30 papers at international scientific conferences. Dr. Uche is also a published author of 4 books. Currently, Uche holds a membership diploma at the Royal College of General Practitioners, UK, and works as a primary care physician in Newcastle, United Kingdom. He also works as a clinical research fellow at Newcastle University and is a creative writer, social critic, and poet. In his free time, Dr. Uche enjoys reading, writing, traveling, swimming, and playing the piano. Listen, everybody, put your hands together as we bring Dr. Uche to the stage. What's up, Doc? How you doing?
I'm good, Patrick. It's good to be here. Thanks very much for having me on this wonderful podcast.
Listen, Doc, I'm happy to have you. And it's great. You sent your bio ahead of time. So, I got a chance to read your bio. But before the bio, there was just your LinkedIn page. And it was something about your LinkedIn page that said, you know what? This is a guy you need to connect with. So when I was exploring your LinkedIn page, I was like, okay, he's a physician and he's a primary care physician and he's an epidemiologist and he lives in a country that's outside the country that I live in. And he's wrote 4 different books and he's published all these national, international articles. I was like, okay. And wait, and we can't just stop there. He plays the piano too and does poetry. Get out of here. Doc, who is you? Who created you, man? You're extremely accomplished. I'm happy to have you, man.
Yeah, thank you. It's my pleasure being here, honestly. Thank you for fishing me out from the crowd.
Man, it wasn't hard to find you. You just put a glow around yourself. So I was like, okay, yeah, this is the guy that I need to connect with. So, Doc, please introduce yourself to the world. Who are you personally?
Okay, I'm going to go very personal and very simple as well. So my name is Uche Anyanwagu, as you introduced. From a family of 6, I'm number 5. Happily married to Ozo, the love of my life, and we have a daughter called Wanne. I was born and raised in Nigeria, and that's also where I started my medical career. First, I started to specialize as a public health physician in Nigeria. Then before I left Nigeria on scholarship to do further sub-study in epidemiology. So that was how I ended up being a clinical epidemiologist, then did my master's and PhD under scholarship in the UK. And after that, I went in again to re-specialize to be a primary care physician. And now I combine both roles in the UK, where I do clinical work as a primary care physician and also as a researcher / lecturer. So in a nutshell, that's just me.
That's you in a nutshell. And I already have tons of questions, but we're going to lead up to those questions because I'm so freaking fascinated with your background. But okay, so that's you personally. Professionally, you became, physician. It sounded like you became an epidemiologist first and then a primary care physician. Is that how that went?
Yes.
Okay.
Yes. So, basically the medical degree, you come up with a medical degree, which makes you what I call pluripotent. So you have the tendency to diversify or specialize in many areas of medicine. So, first of all, I went through being an epidemiologist first, then went back again to specialize as a primary care physician. For some reasons, I will tell you later, maybe.
Okay.
I had to go through this dual path.
I'm already interested in knowing. Okay, we're talking a little bit about your medical, but then you pointed out you're number 5 of 6, so you're second from the last kid. Tell me about that experience, man. How did you fit into the family?
I would say my childhood wasn't that so easy. I'm not just trying to sound like every other. Say we all grew up in the villages and had no water, had no this. But surprisingly too, or fortunately, unfortunately, that was my own experience. So from a family of 5, we lost our father quite early. We lost him 35 years ago. Then none of us was an adult. I was still in primary 4 when he died. So it was quite hard having our mother, who then was a housewife, struggling to raise the 6 of us through university. All of us, we've all graduated, we all have degrees, and even up to master's degree level for 4 of us now. So it was quite hard growing up in the villages, then trying to fend for ourselves. Going through medical school too wasn't that so easy. We have to rely on doing some menial jobs to raise funds. All my siblings, everyone doing their own parts, trying to contribute. Then my mother, with the little she could save or she could get from her little bitty trading. So that was how it was going to school. So it wasn't very, very easy at first, trying to for us, the 6 of us, to really get on with life. And being number 5, you can imagine I have 4 people before me to really pass through this before it got to me. But thankfully, we are all here today, and we are all very happy, and we are all specialists in our different endeavors.
That's a blessing within itself. It sounds like you had some troubled upbringing, a broken childhood, especially with the loss of, the figurehead of the family. And then here your mom is trying to figure out how to raise and support 4 growing, kids.
Yeah,
and
it wasn't easy.
That's not hard. I mean, and I mean, like you said before, economically, it's not like you had a whole lot. So you were trying to figure out which way was up, make ends meet, at the same time, create a future for yourself.
Yeah, and the odds were really stacked against all of us.
Interesting.
We were able to overcome, yeah.
What you said, was it 5 years ago you lost your dad?
No, 35 years ago. 35
years ago. 35 years ago, you lost your dad.
Yeah.
So you didn't really have much of a relationship with him, did you, at this point?
No, it's just that the last 2 years of his life, we lived together. So that's the very first memory of him that I have of us living together. But I didn't, meaning the real sense of knowing things, I didn't. But in a way, to the way he raised us, as if he knew that he wouldn't be there. Because most times in my unpublished book, I've reflected on why my father was a bit strict with us.
Sure.
And I felt that in a way that he robbed us of our childhood, because he really made us to do certain things that we shouldn't do at our own age. We read higher books. I mean, I was in primary 2 and I was reading books for primary 6, reading books for those already in high school, stimulating our minds to really study hard. Sort of, I realized that my father actually maybe understood that he's not going to be on this journey with us. So he had to prepare us ahead, So with that, we were able to, all of us were able to have this self-discipline. We remained focused. We remained committed to whatever we believed in. We believed in hard work. We believed in dignity. I mean, never put soil in our hands or putting our hands in anything, and really reaching out for our dreams, no matter how hard it is. When Lupita said that no matter wherever you are, your dreams are valid, I mean, it speaks so greatly to me, because at the end of the day, we held so tight to our dreams, and at the end of the day, we were able to live it. So growing up wasn't that so easy, but my father was able to give us some of these skills to yeah.
So it sounds like at this point, you've kind of reflected and accepted that your dad was who he was, but he was positioning you and your family to achieve a level of greatness that he wanted for you guys that he hadn't achieved for himself. Is that what I'm picking up on?
That's a summary.
Okay. Yeah. So what's the age difference from the oldest kid to where you are?
So the oldest is 8 years plus.
Okay. All right.
Yeah.
At this point, you got to get in where you fit in. Being the youngest, you got to get in where you fit in. So
I tell you.
All right. I have to know. Okay. So does anyone in your family, did your dad or your mom, did they come from a medical background?
No, not at all. Not at all. My father was a mechanic. Then my mom was those days they used to call them seamstress. I mean, those that sew clothes.
Okay.
But for whatever reason, she never went that commercial. So she sort of sewed clothes for us.
Okay.
Maybe for closer family members, sort of. But she did more of petty trading. So they had no medical background at all.
Okay.
Yeah.
So I mean, you're already giving me some insight into basically your hustle journey. It sounded like you had to overcome some challenges, some setbacks. I mean, the biggest challenge was losing your dad, at such a young age, and looking for guidance and, relying on your siblings and everything else for that mentorship. But, as you navigated through life, as you navigated through this journey, and you look at, who you are today, this version of yourself that you are, help me understand like your hustle journeys, some of those additional challenges outside the family that maybe you face that other people like you have faced as well as you rose through the ranks and became this medical director, this medical doctor.
Okay, so I would say the journey for me started on my father's dying bed.
Okay.
Yeah, as a child, I just made him a promise that I'll be a doctor and I will cure you of your diabetes because he died of diabetes. And very little was known about diabetes then and how it could be managed then in Nigeria. So, although he died a year later, after I made that promise, I still held on to it. And I felt that since this is a promise I've made him, I was unable to fulfill it to him, that I can do that for humanity. So that was actually the inspiration, trying to remain true to the promise I made to my father. I'm not fulfilling it to him, but to everyone. So this actually led me through medical school, which I've already explained wasn't so easy. And it also led me through postgraduate, because after that you do your national service, then you do your postgraduate. And coincidentally, when I finished my master's, shortly before I finished my master's, I now had a PhD offer come through. Okay. And surprisingly, the PhD research was in diabetes.
Oh.
Yeah. So I felt this was sort of life finally setting back to this. I had to do my study on diabetes. I had to figure out so many different drug combinations that will give us the best outcome for patients in diabetes. So it wasn't that so easy to going through that. Then after getting my PhD in epidemiology, which I studied about diabetes, I now had to think about, okay, what do I do about the clinical aspect? Because I didn't just want to go full into research. I still wanted to, have that interaction with patients, talk to patients, try to help them solve a problem. So this was what actually led to the second specialization to be a primary care physician, where I can actually have this doctor-patient relationship, listen to people, help solve their problems or signpost them to where their problems could be solved. So that's just a hustle. Let me just put it that way. In summary for me.
So did that mean you had to go back to school to become a primary care physician, or you could use what you've already learned through the coursework of becoming an epidemiologist?
Yeah, anyway, medicine is quite vast. So some knowledges are transferable, some skills are transferable. For every doctor that graduates, even in the US, they go into residency training. So that builds on your medical background, your medical degree first. So It is not a formal setting whereby you go back to school, but it's sort of where an apprenticeship, I'll put it that way, where you learn on the job. So you learn on the job, you fulfill certain educational components of it, certain clinical components of it, then you write certain exams, then you keep on progressing. You have to do it for some years, because in the UK here is 3 years. I did mine 4 years because I combined it with research. Then in some disciplines you can do up to 7 years, so something like orthopedics, neurosurgery, so it can be longer, where you can train longer to be a specialist in that field. So it's sort of a formal training, but you learn on the job. So you go to work every day, you see patients, but you are under the supervision of someone. Then you try to fulfill all the educational requirements that you need to do and tick all the boxes. Yeah.
You had mentioned too that you have to provide a year of service. What was that year of service directed towards?
Okay, so in Nigeria is made up of about 250 ethnic groups.
Okay.
So we are quite diverse, different people. By the time you move for the next maybe 5 or 10 kilometers, you meet an entirely different people from different culture.
Wow.
That you don't even hear any word in their language, their culture is different.
Right.
So after the civil war in Nigeria of 1967 to 1970, they came up with this idea whereby every graduate from Nigerian university, or any Nigerian graduate, would undergo a mandatory 1 year national service. So it's sort of paramilitary. You have some paramilitary training then you go into local communities that are different from where you are born or raised,
Okay.
or where you schooled, so that you can go to those places, do some community service, you can go teach, you can go do volunteering, you can go work in clinics. Like I worked in the clinics, in the creeks during my own period. And there you contribute to those communities and also try to learn their way of life. So it's a way to bring about integration,
right,
and make everyone see yourself in each other, just to foster national unity. So that was how the program came to be in 1970. And since then, it's been going on that particular way. Quite ideal, practically not really doing it 100% the way it should, but it's a very good idea in the first place.
Yeah, it sounds like a good idea. I mean, on the surface, it sounds good, but I would imagine as a young kid, 18, 19, 20 years old, you're like, really? I got to now do a whole nother year? Like, why,
That's how you learn to be a man. I mean, you have to buckle up, go to places where you don't know anything about their language, you don't know anyone there, then you become part of them. That's the beauty of it.
I didn't realize that Nigeria was so diverse with all these different cultures. So yes. How many different languages do you speak?
About 250.
You speak 215?
No, I don't speak 250.
Oh, yeah. How many different languages do you speak?
Okay. So I think at the moment I speak English is there. That's the national official language for Nigeria. Then my own native language is Igbo. So I speak that proficiently. Then I started my medical career in the South, Calabar, so they speak Efik. So I know Efik I know the primary version of it. I mean, I can have conversation at the primary level in Efik, yeah. Then where I served was in Bayelsa State. I know I can mention some few words there. Not really have conversation, but there are so many words I can mention there as well. Yeah.
So today, are you still a practicing epidemiologist? Is that something you still do today?
Yes, I do that. So the part I'm focusing on, because epidemiology in itself too is quite diverse, are in the field.
Right.
I mean, there are people that are in the field, those that you think about all these agencies that go into local communities to help out. Then there are also some epidemiologists that are maybe in the labs or in classroom or in the labs doing some research. So I fall in within those in the labs sort of, or in classrooms, doing research, gathering data, analyzing data, and providing information from the field so as to use it to drive knowledge, provide evidence that would drive knowledge, that would drive policy formation within the society.
That's the interesting thing too, is because when I think, and again, I have no medical background. So, I'm one of those, regular people looking at these physicians and trying to guess exactly what they do. And so when I think of an epidemiologist, and then I think of what we just went through with the pandemic, I'm thinking, man, you're on the front line. You're out there in the fields. You're researching all these different diseases and medications to try to find a cure. Am I even close?
Yes, that's exactly those in the field, that's what they do. Well. Some people out there, because epidemiology is all about social and preventive medicine.
Right.
It's all about keeping people in good health. Although the word traditionally was derived from epidemics, that's disease outbreak. But the focus then has shifted from preventing outbreak of diseases to keeping people healthy, just to make sure that the disease doesn't even break out in the first place.
Right.
So that's why they will come during COVID. They will tell you social distancing, wash your hands, do this, do that, drink clean water, exercises, all those things. So that's all part of the work of a public health physician and epidemiologist. So it's quite vast, as I said too. So I focus more on the research, the database epidemiology, where from the data they collect from maybe all those that have had COVID jabs, then we look at the data and know who is reacting to it, or how does it favor this group of population as against this group of population, stuff like that.
All right, everybody, if you're just joining, welcome to another episode of Health Hustle Chronicles, where the grind meets growth in the world of healthcare. And we have a very special guest who goes by the name of Dr. Uche Anyanwagu. And he is the clinical epidemiologist, a public health physician with expertise in research and patient care. He holds a medical degree from Abia State University, a master's and PhD degrees in clinical epidemiology from the University of Nottingham, and has published over 40 research works in international medical journals and presented over 30 papers in international scientific conferences. He also is the author of published books of over 4 different books. So right now we're just jumping into his background, learning about, him coming up from school age into, him getting accepted into a university and now becoming a physician in both epidemiology as well as being a primary care physician. I have a question for you. I'm looking at your title and, we love the little initials after our title, right? And you have MD. I know that stands for medical doctor. You got PhD, which stands for doctor as well, right? And then what's the MRCGP? What is that?
Okay, it's the membership of the Royal College of General Practitioners. So that's the membership diploma when you specialize as a primary care physician.
Okay.
Here in the UK, they call it general practice. In America, it's family physician.
Okay.
And some other places, they call it primary care physician as well. So it means membership of the Royal College of General Practitioners in the UK. Yeah.
Got it. Also in your bio, it states that you're a creative writer, a social critic, as well as a poet. So tell me about this. What am I missing?
Nothing much. I always say, I usually quote one Russian doctor writer as well. He said, medicine is my lawful wife. Literature is my mistress. When I'm bored with one, I spend the night with the other. So for me, it's medicine. But literature writing, creative writing is actually another part of me that I love exploring. And for me, it's a way that I sort of destroy this world around me, create the type of world I want to, sort of create a fantasy and create characters I want to, allow them behave however I want to, kill them when I want to kill them or keep them alive.
Sure.
Stuff like that. So I love being creative writing. Then again, writing is a way I reflect my thoughts.
Okay.
And the books I've written and published today are more or less based on my own experiences, because one thing I learned earlier in life, thankfully I owe to my father, is journaling. So I just write, putting things down once they come across my mind or once I experience things. My father used to give us diaries then, so just put how our day went. So it sort of helped me to also learn how to be reflective of my days. So I brought in that into the books I've written. Then again, as an Igbo person, storytelling is well known, is a very important aspect of our Igbo culture and society. Traditionally, these were told orally passed from one generation to another. But the truth is that as they're being told orally, they're being diluted along them.
Okay.
The Chinese said that the palest ink is far greater than the most retentive memory. So the best way is to write things down. So sometimes I use stories which are relatable to pass across, either do my own reflection about my own thoughts, or to pass across my message against the government in power or anybody, however I feel. Because I had this series on Facebook I called Ranting, where I just critique or say my mind exactly the way I love it. Okay. And this is throwing jab directly at the government. Then I also have the creative side of things, where I sort of write stories or write things that will actually maybe educate, edify, inform people, or entertain people, whichever way it goes. So that's one thing about me, that's the creative side of me. And that was how I ended up with I have 4 books, but 3 currently are on Amazon. So I have poetry. That's where I sort of reflect the voice that speaks to me. Okay. And I try to put them down. I don't speak. I don't own those voices. I don't own those words. They speak to me and I put them down. I'm just a messenger there. Then I also have my book, Before Your Next Sex, which is a novel. Then I also have another one. Before Your Next Sex is a collection of short stories. Then I also have the Compass Floating Stethoscope, which was my experience during my national service in the creeks. It's called the Compass Floating Stethoscope. So I've got them. I think I just so this is the Compass Floating Stethoscope.
Okay.
Yeah, which is a chronicle of my national service in the creeks. Then I have this other funny title book, Before Your Next Sex.
Ooh, it sounds intriguing. Is this some like eyes wide shut type stuff? Ooh, what is that?
I do get that question a whole lot. Well, I tell people it has nothing to do with that, but it also has everything to do with it.
Okay. Listen, I mean, you opened it up and you sold the book, so please tell us what is the book about before your next sec. You already got me with the title, so I definitely would have got it. So what is it?
Yeah, I purposely chose this very contentious title because from my own culture to where I'm from, sex is something that people don't talk about.
Okay.
In fact, in this book, I describe it as the food that, how did I put it? I said, it's that food that everybody eats. You go to a restaurant, everyone is eating it, but you never find it on the menu. So that's one thing about sex, the food that we all eat, but it's never found on the menu. Don't talk about it or just do it. So I purposely chose this to strike that conversation so that we begin to have conversations around this. Then the second reason why I chose this title is one of the stories, I think chapter 15 of this book, about a little girl that has gone to procure abortion because abortion is illegal in Nigeria. So she actually went to quacks. And at the end of the day, she had complications and came to see this doctor who, after seeing this child and how this child's life has been messed up by this, and without the child not having even basic knowledge about her own sexual biology, she doesn't know how to count her menstrual cycle and things like that. So the doctor was so distraught, and what he did was to write a letter to his own child to say, before your next sex, I mean, you have to know about yourself, know about your biology, know about simple things about menstrual cycle and the rest of them. So it was quite instructive. And that's where I derived the title, Before Your Next Sex. So it's sort of an instructive book, an educative book that uses the power of storytelling to drive home certain messages, because I wouldn't want to write any medical book. I don't want to read one myself. It can be quite boring.
Right.
But everybody loves good stories. Everybody wants to listen to stories. So what I did was to use the power of storytelling, put it in fiction, but they're all based on real life experiences of what happened to me, what I encountered in clinic myself personally. So I put them in form of a fiction, and I'm able to write it to stories that people around me could relate to it. So here, this is just a collection of 30 of them. And I purposely left it at 30 because reading culture too is a bit poor in my place. So to encourage people to read, I tell them the doctor's prescription for this book is one story a day. So you finish it in 30 days. In a month, you should be done with the 30 stories in here. But the report I've gotten is that many people finish it in a go, because once they start it, they don't just they want to hear the next story. Or what's the next story? What are they going to say in the next story?
Right.
So that's about this book.
Listen, that's a dope story already. That I love how you use the title to really hide the real reasoning behind the book, and it creates interest and people want to buy it. Because I know if I'm on a flight, I'm like, okay, you stop at the little stores and they got all the little different books on the stand. I would have picked that book up and be like, babe, you want to know what I'm about to read? This is about to be good.
Exactly. I've had a lady that bought it and had to cover it to read it because of what her husband would think.
Yes. All right. So I'm going to ask you a biased question right here, and I expect a biased answer. And that's so you've written 4 books. Which one of your books is the best book and why?
It's just like asking someone to say your favorite son.
Yep. I want to know.
Your favorite child is quite difficult, but for me, I'll still go for this.
Okay.
A whole lot of, because as I said, there are 30 stories here, and they're actually my encounter while working in Nigeria as a clinician.
Okay.
Yeah, so I would still go for this because there are so many stories in it that actually got me so overwhelmed. There are certain patients that will leave my clinic, I will just close the door, possibly just cry a bit or set my mind thinking. So it's a book where I poured a whole lot of emotions in. This is also emotional, but not as much as this.
Right.
Yeah. So I'll go for this, but apologies to all these other books.
And you can get both of those books are available on Amazon today?
Yes, they're available on Amazon. Yes, they are.
Yeah, hold them up again for the camera so people can see those books again. So we can do it. Go ahead.
Before Your Next Sex. So if you go on Amazon, you find it. Then this is a collection of short stories, 30 short stories.
You can read it in 30 days. I love that.
Exactly. Then this is The Copper's Floating Stethoscope, which detailed my experiences in the creeks, in the Niger Delta creeks, when I did my 1 year national service there. And I was in a boat which was poorly maintained, and unfortunately the boat capsized. Yeah, and we were saved. It was in the Atlantic, funny enough.
What?
Yeah, I was with my life jackets, and we were saved. The only thing I lost, funny enough, from the luggage compartment was my stethoscope, because it was in a park, so the park slipped off. And I just saw it from afar floating, but I was so terrified to even say anything. So when I wrote that encounter, I felt, oh, that stethoscope that was floating, may it bring healing maybe to those communities that it passed through. And that was how this book was born. So the Compass Floating Stethoscope. It's a very lovely book that make you understand Nigeria, a little bit of Nigerian politics and the Niger Delta, the oil-rich region in Nigeria, which unfortunately is so deprived despite the wealth they provide for the country. Then I have this poetry, Song to My Soul. As I said, just a collection of poems.
Okay.
So they are my poems. I wrote them, but I always say that I'm just a messenger.
Right.
I just write the voices that speak to me.
Listen, that's what every artist says, that I'm just the messenger. Come on, get out of here.
So these are on Amazon. Then the first one I wrote is no longer available.
Okay.
I mean, it was never on Amazon. I wrote it quite early, and I'm no longer in contact with the publisher, so I no longer have rights to that.
Okay, got you. Doc, a little birdie told me, and correct me, let me know if I'm right or wrong, but a little birdie told me that you had an opportunity to meet the Queen. Yes or no?
Yes.
Oh, come on now, you gotta give me the goods on this. What happened? How did that come about?
I came to the UK under the Commonwealth Scholarship. So the Queen is the head of the Commonwealth. And in March of every year during Commonwealth Day, so they have this tradition of randomly selecting some Commonwealth scholars to have a dinner with the Queen. Unfortunately for me, I got a card, a printed card, embossed with my name and everything from Her Majesty's.
Okay.
I tell you, I have to frame that card. It's somewhere.
Yes.
Yeah, I'm going to frame it. So I got it, inviting me for that. And it's one of the greatest highlights of my being in the UK so far, honestly. In fact, it's the highest I'll keep saying. So we all gathered, the palace protocol. They had to all tell us everything to do, took away all our phones, told us, the courtesies and how you don't shake the Queen unless she brings out her hand to shake you.
Okay.
You don't talk to the Queen and you're moving your hand, so you have to either put it back or this way, so all those protocols. And she now moved into the gallery where we are all standing waiting, and took time to interact with every of us for at least a minute or two.
Wow.
So went through, we all had our badges. She would try to call our name.
Yes.
Asked us what we are doing and how we're finding the UK, just a very friendly chat that we had. So she came to me and we had a chat, and it was after she left that it just dawned on me, wow.
Right. Yeah. That's when it hits you like, man, I actually did something.
I just had goosebumps all over.
That is awesome. All right. So do you remember what you ate that night? What did y'all eat? What did you eat?
Honestly, that was where I was also disappointed. It's one of the culture shocks that I had, because I was quite new to the UK, and just a mixture of everything. I can't even. But I felt that we were going to eat very, very heavy meal. So it was more of the wine and all the little tiny bits here and there that they were passing around on the tray and the rest. So I felt that we were going to really sit down and eat the heavy Nigerian meals that we used to eat, but that night when I got home around 12 o'clock, I just had to go and find something to eat myself.
It sounded like you had a bunch of hors d'oeuvres is what they were passing around. That's all it was.
Yeah, exactly. So I felt I expected maybe very heavy meals and everything, but it was one of the, when they tell you to come for a cocktail or a dinner with the Queen, it doesn't just mean you sit down and eat and maybe go home with takeaways.
Listen, your story is so eye-opening, not only inspirational and motivational, but there's just so much to this, and we've only been chatting for a short time. I mean, we talked about, how you've been shaped and molded by the strength of your mom.
Yep.
From the loss of your dad, right?
Yep.
To your upbringing, you finding your place within the family, learning how to connect with yourself through journaling, storytelling, finding solace in entertainment through other people as well, and then navigating this whole professional journey, becoming an epidemiologist, primary care physician, serving your community and your country for over a year, and then transitioning to being poets. You almost drowned in the freaking Atlantic, right? And then you met the Queen too. Man, come on.
Yeah.
This story is not real.
So you can see it's just been exactly like it's very typical of the journey of life. So you can see it through the highs and the troughs. The
Absolutely.
highs and lows of life. Yeah.
Absolutely.
I'm thankful for every part of the journey, the highs, the lows. I mean, they actually shaped me and they made me who I am. And I'm very thankful. And I don't think I would have preferred to have it any other way. Except
right.
this. Yeah.
All right, guys. So if you're just listening to this and you're not actually watching this, obviously we're speaking to Dr. Uche Anyanwagu, right? And he's a Black Nigerian by way of UK. And I point this out just if you can't see them. So, and I'm setting this up for a couple of different reasons. One, because Doc, I mean, you came dressed to impress, and people need to know that you look good on camera, man. So let me give you your kudos now. You look good on camera, right? But the question is how I'm setting this up is, all right, so as a Black man in the UK, becoming a physician, I guess what information for like younger versions that are, 10, 12, 15 years old, how would you inspire them to help them mentally prepare to navigate this route that you've already accomplished, that they're looking to accomplish for themselves?
Yeah, there is a book I've been putting up about my academic journey. And the last part of the book, it's not yet published, but I'll just quote some parts of the book. The title is The Validity of Dreams. And I quoted Lupita Nyong'o there saying, no matter wherever you are, that your dreams are valid. So my advice to the younger people is your dreams are valid. Number one. Two, there are no scales to measure any dream or to measure any ambition. You can be as ambitious as your heart and mind can carry. Don't dream less. That's another thing. Then number four, dreams are personal. They're actually yours. Because you alone can give an account of what you dreamt. Even if you saw me in the dream, I cannot be a witness because you alone dreamt it. So the dream is actually owned by you. Be selfish about your dream. Then again, it only becomes a dream after you've woken up. So even as you are dreaming too, wake up and pursue those dreams, because if you remain asleep, it remains a dream and will never ever come to fruition. So don't dream less. Don't think you're being too ambitious. Wake up, walk towards your dream. There is a poem that we read then in secondary school, and I'll just quickly go through it. He said, once you get the questions right, your dreams will take flight. Take you to a new height with bright shining light. So read with all your might and keep the dream in sight. To your goals, hold tight. You will be all right. So I always tell the younger ones this: hold on to your goal. You'll be all right.
I love that, man. I'm going to have to, just this little segment right here, I'm going to have to crop this and I'm going to share it with my kids. I'll be like, listen to this, man. You can dream as big as you want to be, right? But don't let those dreams burn out. Because Doc told us you don't have to let them burn out. Go chase them.
Yeah. Chase them. Don't keep sleeping. Wake up. Chase it.
That's a great message. So I have to ask you this too, Doc. You have a lot going on. I mean, we're talking about you're raising a family, because we barely talked about you, but you're raising a family, married, you have kids, you have a practice, you're still educating yourself.
Yep.
Cut this out. We'll edit that part out. So you're still educating yourself, you're still giving back to yourself, and helping your kids navigate this world that we're living in as well. I would like to know, how do you go about separating your personal life from your professional life?
I would say it's one of the most difficult things to do as a medical doctor, because the lines are quite blurry, given that we serve humanity. So most times, even when you think you're resting, you can be in a park and someone is having a heart attack, and that alone, you have to really help out.
Right.
You may end up in the hospital with that person, or in an ambulance, or in a flight taking the person to somewhere else. You are not working that day. You're meant to be on holiday. Right. So it's quite hard to have this boundary. But all the same, too, one thing I try to do is also, once I'm out of work, I try to log out of work.
Okay.
I don't even enter my house with my physician's bag.
Okay.
It stays it's locked in the boot of my car. So that's outside. So I try as much as possible to separate it from there. And people go through you through phone, through other means. So I also try to cut that down and have some time, especially the days I'm not going to work, that I'm meant to be with baby or take baby to school. So I have to really be there. Then we also make our time for family dinner, going out, having some time together. I mean, locking away our phones. It's quite hard, I'm not saying. So our job is quite demanding, but I also try, something I'm really, really working on, to have that very clear boundary between work and this. And again, being a creative somebody, it also hard for me. I mean, the other day I was sleeping and an idea came to me about a research, something I was trying to crack. Next minute, I saw myself on my computer, not for the next 2 hours, trying to put the code that just came to me, trying to make sure I don't lose it.
Right.
It can happen, but we keep trying.
That is, like you said, especially being a researcher, because like you said, once you get that light bulb moment, you're like, oh, I got to capitalize on this right now. I'm going to miss it.
Oh, you miss it.
All right. So I know a lot of physicians, because you're juggling, professional and personal together, that oftentimes it's hard to give back to yourself. So how do you go about trying to take care of yourself, like that self-care, making sure you stay in shape, you're eating right, you get the exercise, all that good stuff?
Eating right, yes, I try my best. Exercising, not really where it's meant to be, because most times having a routine is hard. Most times you do some nights, you go for out of hours and come back early in the morning. So you'll be able to go out for morning jogging, or at times, the work routine is not that so well spelled out. So that in a way alters the routine of doing that. But even in my work too, I try to factor in certain things, like unless it's up to more than 7 floors, I have to use the stairs.
Okay.
I have to use the stairs. So there are so many things that within workplace that you try as much as possible to just keep fit. Don't use the stairs, don't use the lift. Or this is a 50-minute walk to this place. Okay. Walk it, speed walk it, run it. So that way too, you begin to count your steps and you try to keep fit. Then some other days when you now have time, I usually take a walk with my family. So go the stroller with the baby, do some 5-kilometer walk, and something like that, and come back. So we just try as much as possible to keep fit. Then, as you said, also having a clean mind helps, and that's where my creative writing aspect comes into. I love traveling. That's actually where I get most of my inspiration.
Okay.
And where I love long haul flights, maybe flying to Canada or something like that, is that within that period, I'm just alone with the clouds, with my God and with my brain. So inspirations flow then, because I have less distractions.
Yes.
I'm able to write. I'm able to voice record.
Sure.
Ideas that are coming in straight ahead to me. So traveling helps me to then seeing different places, meeting different people, new cultures they also inspire me. So that way too, it helps me to distress. I used to travel quite a lot, but just with family coming to, it becomes a little bit difficult to do as often as you used to. Yeah.
How often do you go back and read old stuff that you wrote? Do you ever do that? How often do you go back and read old stuff that you had wrote? Maybe it was in your journal, or maybe it was old research papers. Do you ever do that?
Yeah, I do. Yeah. I do. At times when I feel so lazy,
right?
Oh, you wrote this.
Yeah, exactly.
Stuff and come on, go back to shape.
Yes, love that. Okay, so Doc, when it's all said and done, right? When the lights go off, we've departed this world. Tell me about the impact that you would like to leave behind.
One, I just want my life, above all, to be such that will inspire people. And I've had so many people that have come up to me to tell me how even the little I've lived has really inspired them, made them believe in certain things that they felt was not possible. I do try as much as possible to make our time to speak to people from my community where I grew up in. So I'm not telling you any lie. You saw me grow up. You saw how hard it was for the family.
Absolutely.
So, and you know me today and where I am. So if I could do it, yes, you can yourself. So I also try to mentor and speak to people from my local communities. Then I also try to mentor my junior colleagues in the medical school as well. I have so many of them. And recently too, I'm volunteering for the Black medics in the UK. I have some people I mentor as well there. So I really want people to sort of shine the light and let them come up I have this philosophy that I'm not better than any of them. It's just that I went ahead of them.
Yes.
And
Yes.
I strongly believe that they will be able to even do more, far more than whatever little thing I've achieved at this particular point in time. So when I'm dead and gone, I just want to be remembered as someone who entered the room and provided the light that was able to lead or to show others their paths. So that's what I want to be remembered for.
Listen, if the podcast was ending right there, that's how you end a podcast right there. That mic drop, pencil down, whatever. Listen, lights on. That's it. The show is closed. He came and delivered. Oh my goodness. What? Let's go.
Thank you.
That's how you close out a show. Listen, guys.
Yeah.
I'm almost thinking of closing the show out. I had another question for you. Listen, okay.
Go ahead. I still have so many more to say. Go ahead.
Please tell us, tell the world, how do we get in your orbit, right? So what's your social handles? How do we connect with you? Follow along with your journey? Please share that information.
I have to put out this.
Okay.
Just people, I'm very, very approachable. I'm very, very reachable because I have seen what it feels like reaching out to people and being ignored. It's not a place I want to put anybody in.
Okay.
So my social media handles, they're all free and people are free to reach out to me. If I have not responded, just know that I've not opened it to read. Okay. I respond to everyone. It's only when someone is being unreasonable that I can just ignore you completely. But as for giving a hearing ear to everyone, I do that, no matter how busy I am. So on Facebook, but my social media handle is Uche Anyanwagu. That's what I use everywhere. So on Facebook is Uche Anyanwagu. On Instagram is Uche Anyanwagu written as one word. On Twitter, Uche Anyanwagu written as one word as well. Then on LinkedIn is Uche Anyanwagu. Then if you go to Amazon as well and type Uche Anyanwagu, you find my books and my works on my account on Amazon. Then for my academic works, if you really want to get them on ResearchGate, Google Scholar, or ORCID, just type my name Uche Anyanwagu as well. You'll be able to find them. Then I have my website. We are restructuring it. So what was it last year is no longer what is there at the moment. We are working on it. So my website is still www.ucheanyanwagu.com. But at the moment, you may not just see anything there, but just give it a month or two to revamp it. Yeah.
Well, Doc, I need to know this here because, we all get older and our dreams gradually change, as we get older too, because the aspirations, our lifestyle, all that changes, and it leads to us wanting to make additional pivots in life. So as you think of, your career, you think of yourself probably over the next 15, 20 years, what version of that is going to show up? What do you think?
I think the version that will show up more is sort of advocacy. I intend to, as I grow older, to leave the clinic actually.
Okay.
And move more into the communities, being able to use my knowledge, my connection, my network to reach out to the unreached. So I intend to sort of do more of moving out to the interior places. I'm very, very much interested in health education because if you also read my book, it was actually meant to debunk so many medical myths that have held our people back and affected their health-seeking behavior. So it's something I want to do. I mean, in 2022, I was able to do a conference sort of around the country, around Nigeria in 5 cities. I use it to do the book as well. But the aim of the conference was just to have that conversation about how our culture, our spirituality or religion, how they all interfere with our knowledge, our medical knowledge, and our health-seeking behavior. So it's something that I want to really build more on and get to educate people, go more and try to debunk so many unfounded cultural beliefs that have led people to an early grave. Because I really want our people to be healthy. I really want to be in good health. I really want our children. A child was asked, what does he want to be when he grows up? He said he wants to be alive. So that's quite telling.
Oh, wow.
Yeah, that's quite telling. Just to be alive. Just let me reach my 5th birthday. Let me reach my 10th birthday. So I really want to help talk to people or help advocate for the things that make people to actually be alive and live out their full potential. Not just being alive, but living actually.
Got it. That's so real. Like I felt every single word because I can resonate with it. And I know other people that's gonna listen and watch this, they're gonna feel every single word. They feel the same way because that's what we all really want, right? Is to create those opportunities for our kids to continue to expand and grow and experience, to live the life that maybe we didn't live, but we wanted to live.
Exactly.
You know? That is really dope, Doc. I appreciate that. Hey guys, listen. This has been another episode of Health Hustle Chronicles, where the grind meets growth in the world of healthcare. As you know, I bring you the freshest, the livest guests from around the world, Craig. And today we have a very special, very special guest, Dr. Uche Anyanwagu. He's a medical doctor, also a clinical epidemiologist, primary health physician with expertise in research and patient care. He holds a medical degree from Abia State University, a master's and PhD degrees in clinical epidemiology from the University of Nottingham. He has also published over 40, and I said 40, research works in international medical journals and presented to over 30 papers at international scientific conferences. He's also a published author of 4 books, which, we'll drop the links later so you can connect to him and go pick them up on Amazon. And he currently holds the membership diploma of Royal College of General Practitioners from the UK and works as a primary care physician in Newcastle, UK as well. He also works as a clinical research fellow at the Newcastle University. And if you thought that was all, it's not. He's also a creative writer, a social critic, as well as a poet. And in his free time, he enjoys reading, writing, traveling, swimming, and playing the piano. We didn't even touch on the piano piece, Doc. I mean, that could be a whole nother conversation, because I know if you put as much focus and energy, if you're doing everything else, I know you put just as much in playing the piano. So I know that's going to be some dope skills you have as well.
Yeah, sure.
Doc, I'm going to leave this last segment right here for you to say whatever you want to say to the world and the people that's listening and watching.
Yeah, so when I say my parting words at the moment is to tell people to believe in themselves, trust yourself. You think more than you know more than you think you do. Then the second thing I want to say, especially to the younger ones, is to believe in themselves. I have this saying that the brain is nothing but a piece of uncultivated fertile ground. So our brain is quite fertile, but you have to cultivate it. Right. You have to put in the right seed at the right time, put in the right work to be able to have the right fruits or to have a bountiful harvest that you want. So let people not limit themselves in what they can do. Most times we limit ourselves, but I think that we are created for more. We can do more. And that's why I can be a medical doctor, I can be a creative writer, I can be a pianist, there are so many more we can do if we really set our minds to do it. So let us stop limiting ourselves. Let us stop allowing the environment we are born in, we are raised up in, to limit us. Dream big, fly high. No matter wherever you are, your dreams are valid. I would say that. Listen, if you didn't have a fan before tonight, you have one tonight. Like, I'm the newest fan, so I'm jumping on the bandwagon, and I'm encouraging everybody else to come with me. Let's get on this bandwagon, man. This has been amazing. Not only has it been amazing, Doc, it's been a blessing. It really, really has. To be able to learn from you, to listen to you, to continue to follow you, and then to learn about the impact that you're making today, as well as what it holds for the future. Yeah. Thank you very much. I enjoyed this. I really did, man. Thank you. Yeah, me too. Thanks very much for inviting me and for inspiring me too. Thank you.